It's pretty discouraging how expensive medicines for multiple sclerosis can be. So today, let's look at some options that are actually quite inexpensive and accessible to almost all of us. Well, hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for 40 years. I apologize for the bad lighting, but I haven't been able to figure out what to do now that the sun isn't shining. All the supplemental lighting I try to do just reflects off my glasses, and so that doesn't seem to be a real solution. So I guess throughout the winter, we may just have to live with the picture not being quite as crisp as we might like. Most of the last few months I spent looking at new clinical trial results that showed that a number of pharmaceuticals show some promise for multiple sclerosis, and we've all been pretty interested in those. But I thought it might be time to take a little break and step back and see what might be available to us in more of the area of what they call nutraceuticals, which would be things that you can buy in the grocery store. You might even already have them in your pantry. They don't have a patent on them. No big pharmaceutical company is sponsoring them or holding the rights and the access to them. And after all, the video that I've made that's gotten the most views has been the one I did on mushrooms a couple of years ago. I've never topped that one, and it still gets views to this day. So I have a feeling that there might be some interest in just knowing what kinds of natural products will be available that seem to pass muster even after clinical trials. So let's look together at 3 articles that cover the findings from the past couple of years. The first article that I wanted to look at today was in Multiple Sclerosis News Today. It was published on February 2nd of 2023, but I was interested in it because it talks about things that we can easily acquire and do. The study that they funded, coconut oil and green tea lead to gait balance gains in multiple sclerosis patients. Now, if I can drink green tea and put coconut oil in my coffee and get good results for gait and balance, I would love that. So let's find out more. Okay, it says supplementation with coconut oil and epigallocatechin gallate, or EGCG, a green tea extract, in combination with a Mediterranean-style diet, was associated with improvements in balance and gait in people with multiple sclerosis. These were the findings of a small study in Spain, which also found that all participants, including those receiving a placebo in combination with a Mediterranean diet, experienced gains in endurance after 4 months. The administration of EGCG and coconut oil seems to improve gait speed and balance, the researchers wrote, adding that the healthy Mediterranean diet allowed by all the patients in the study could explain the improvement in gait resistance or endurance. The study, which was called Improvements in Gait and Balance in Patients with Multiple Sclerosis After Treatment with Coconut Oil and EGCG, a pilot study, was published in Food and Function. They say that MS patients took coconut oil and green tea extract supplements. The inflammatory environment that characterizes MS contributes to the dysfunction of mitochondria, cellular components that function as energy production centers and are known as the powerhouses of cells. Ultimately, the energy balance of nerve cells can't be maintained. This can lead to oxidative stress, a type of damage caused by an impaired clearance of reactive oxygen molecules by the body's antioxidant defenses. Ketone bodies, molecules that are produced from fatty acids in the liver, have been shown to restore mitochondrial activity. These molecules can be obtained from dietary sources, which form the basis of the ketogenic diet that has been found to benefit MS patients. And I will link the video that I recently made on keto diets. The largest source of ketone bodies are medium-chain triglycerides like coconut oil. Meanwhile, EGCG, the main component of green tea, has demonstrated a range of anti-inflammatory and antioxidant effects in preclinical studies. Researchers believe that coconut oil and EGCG supplementation in combination with an anti-inflammatory diet may be beneficial to neurological and muscle function in MS. To find out, a pilot clinical trial, and there's the number, was conducted in Spain to evaluate this dietary supplement combination against a placebo among 51 adults with MS. The participants also were all instructed to adhere to an anti-inflammatory Mediterranean-style diet, which has shown meaningful benefits in MS patients. All of the patients were using standard MS medications, including glatiramer acetate, sold as Copaxone, among others, or interferon beta, Rebif, or beta-seron. So that's interesting. These are old school meds. Most of us aren't on those anymore. But the study's not even that old. I'm not sure why they chose those in particular, but I guess what they're saying is they didn't tell people they had to stop their MS medications in order to be part of the trial. Their specialized diet consisted of 5 small meals per day with 20% protein, 40% carbohydrates, and 40% healthy fats. And again, the keto diet, I think, would look for less than 40% from carbohydrates. But of course, not all carbohydrates are created equal, so we'd have to dig into that a little bit more. But the Mediterranean diet has been lauded as one of the best overall diets to have. So you can't really go wrong. The thing that one does is eliminate junk food from your diet. And if you could just do that, you'd be way ahead of the game. They go on to say that the supplement group also took 60 milliliters of coconut oil, 30 milliliters twice a day, and 800 milligrams of EGCG, a 400 milligram capsule twice per day. Participants in the control diet group were given 60 milliliters of another type of oil and placebo capsules in place of EGCG. This diet and supplementation were maintained for 4 months. Results previously published demonstrated that the treatment led to significant increases in blood levels of beta-hydroxybutyrate, a type of ketone body with neuroprotective properties. And in my video, I do talk about butyrate, so there's definitely a connection between this study and the one that I looked at in the other video. Patients receiving the supplementation also experienced significant functional improvements, according to researchers. And the functional improvement is really what all of us are going for. It's great if healing is going on under the surface and stopping all of the damage, that's good. But until it translates into quality of life, most of us really aren't going to be all that excited. They say that in the new study, the team reported other results related to balance and gait after 4 months of treatment. That's really a short time. These findings showed that patients using the supplements experienced significant improvements in objective balance assessed with the Berg Balance Scale, whereas those in the placebo group did not see improvements. However, patients' perceptions of balance were not improved in either group. The supplement group also exhibited significant increases in gait speed. Specifically, their speed increased from a median 1.56 meters per second in the 10-meter walk test before treatment to 1.73 meters per second after 4 months. That's an increase of more than half a foot, from about 5.1 feet to about 5.7 feet. The placebo group, in contrast, experienced a non-significant reduction in their walking speed from 1.7 meters per second to 1.61 meters per second, about 5.6 feet to about 5.3 feet. And they say that endurance as measured by the 2-minute walk test was significantly improved in both groups, with patients seeing an increase in the distance they could walk in 2 minutes after 4 months. Likewise, both groups saw significant improvements in muscle strength in their right lower legs. However, only the group receiving the supplements experienced gains in right thigh muscle strength. Overall, the nutritional intervention in the present pilot study achieved a significant improvement in both balance and gait in MS patients, the researchers wrote. The team noted that gains in balance and speed in the intervention group could be due to a combination of muscle and neurological impacts, including benefits to the brain's frontal lobe for improving balance and a boost in muscle fibers involved in large and forceful movements. The fact that both groups saw gains in endurance may be due to the change in diet of the study participants, the researchers wrote, noting that a Mediterranean diet has been linked to improvements in gait resistance and not to other variables such as speed. And I thought we could take a look too at this article that I also saw in Multiple Sclerosis News today. This one was published December 28th of 2022. So again, these are a little bit on the old side, but nutrition is timeless. The title of this article is Walking Difficulties Improve for MS Patients with Natural Supplement. Using MS-14, a natural product from Persian medicine, led to physical activity gains. They say that daily use of MS-14, a natural product derived from Persian medicine, safely led to gains in physical ability and walking for people with multiple sclerosis with walking difficulties, according to data from a small placebo-controlled trial. MS-14, which contains both herbal and marine ingredients, could be used as a safe supplement along with other medications, including symptomatic and disease-modifying therapies, for better management of MS patients, the study's researchers wrote. Adding larger trials are needed to validate the findings. And I don't know whether those larger trials have happened. The study, Effect of MS-14 on Physical Activity of Multiple Sclerosis Patients, a randomized triple-blind placebo-controlled clinical trial, you can't get better than that, was published in Multiple Sclerosis and Related Disorders. Complementary and alternative medicine practices have gained increasing consideration as components of treatment regimens for complex diseases such as MS. This includes natural medicines and so-called nutraceuticals that consist of dietary supplements such as herbs, vitamins, and minerals that are thought to offer additional benefits while maintaining an optimal safety profile with minimal side effects. We are all in favor of that. MS-14, a nutraceutical derived from Persian medicine practices, contains 3 natural ingredients: king prawn 90%, celery 5%, and St. John's wort 5%. A number of preclinical studies have shown it to be safe and able to modulate components of the immune system implicated in MS. Moreover, MS-14 was shown to prevent brain tissue death and inflammation and ease symptoms in an MS mouse model. Interesting, right? That it also would control inflammation, which is one reason that our symptoms tend to flare. While it was found safe in MS, its potential clinical benefits in this population haven't been extensively studied. Previous work from some of the study's authors found MS-14 might improve quality of life for patients, but its effects on other clinical factors aren't known. And they have a section here, MS-14 supplement on physical activity. Researchers in Iran conducted a randomized placebo-controlled clinical trial, and there it is there, to evaluate the effects of MS-14 on physical activity in MS patients. The trial involved 80 adults with MS who had walking difficulties and muscle spasticity. To be included, patients had to be able to walk more than 5 meters with or without help. Participants were randomized to receive MS-14 oral capsules of 500 milligrams or a placebo 3 times daily for 3 weeks. Among the 42 participants in the MS-14 group, 95.2% women, the mean age was 40.5, whereas the placebo group comprised 38 participants, 86.8% women, with a mean age of 38.5. Now, I don't know if it's statistically significant that there was a difference in the percentage of women and men in the 2 arms of the study. The study's main goal was to evaluate changes in general physical activity after 3 weeks of MS-14 as assessed with the International Physical Activity Questionnaire, or IPAQ. Results showed those in the MS-14 group had significant increases in IPAQ scores reflecting an increase in general physical activity. These gains were significantly superior to the placebo group, in whom no significant changes were observed after 3 weeks. MS-14 treated patients also saw significant improvements in moderate physical activity, while the placebo group didn't. Those in the MS-14 group had significantly lower moderate activity levels at the study start, however, so there's a confounding factor that they knew they had to take into account. Patients in both groups saw significant improvements in spasticity severity, as measured by the Ashworth scale and the time to get up and go test, a measure of mobility. In contrast, only those in the MS-14 group had significant improvements in fatigue and the timed 10-meter walk test, which measures walking function by assessing how long it takes to walk 10 meters. Gains in this test among those given MS-14 were statistically superior to the placebo group. The researchers noted that some patients also self-reported improvements in urination control, but this was not a study outcome and was not statistically analyzed. Still, further investigations of this finding are warranted, they noted. No side effects were reported in either group. Overall, our findings, in conjunction with previous studies, indicate that MS-14 may prove to be useful as an adjunct symptomatic treatment or potentially immunomodulatory agent to current disease-modifying therapies, the researchers wrote, noting that larger and longer studies will help validate these findings. So you wouldn't give up your DMT, but this would go along with it, apparently, to have the maximum effect. While the anti-inflammatory and immunomodulatory properties of MS-14's main ingredients are likely the drivers of its beneficial effects, it also contains a number of other salts and trace elements that could play a role, they said. So they're acknowledging that they maybe don't understand totally the chemistry of this thing, but these compounds do seem to help. And I particularly was struck by them saying that it helped with fatigue, because I have been on a tear trying to find something that will help me with not just physical fatigue, but I guess I would have to call it emotional fatigue, where I know that my ability to resist losing my temper is at a low because I just don't have the reserve. I don't know if you've had that problem as well, but I am always looking for something that will help me with fatigue. And here's another article from Multiple Sclerosis News Today, and this one is a little more recent, September 20th, 2024. It comes out of the ECTRIMS conference that they just had. High-dose vitamin D can help delay progression to multiple sclerosis. Fewer patients on vitamin D had evidence of disease activity at 2 years in the study. They say that taking high-dose cholecalciferol, vitamin D, as a supplement is safe and can nearly double the time it takes for people with clinically isolated syndrome, a first manifestation of neurological symptoms suggestive of multiple sclerosis, to experience new disease activity. That's according to data from DELAY-MS, and there's the clinical trial number, a phase 3 clinical study that tested whether a high dose of cholecalciferol, 100,000 international units, that is a massive dose. I wouldn't try that at home, by the way, was safe and could delay the progression of CIS to clinically definite MS. So for those of us who already have MS, vitamin D is probably still good. But this study particularly looked at whether someone having, say, a first suggestion that they might develop MS, taking high doses of vitamin C, it seemed to stave that off. And that is interesting to me because I'd like to know, and hopefully this article will tell us, does that mean the person has to continue on fairly high doses of vitamin D, or does one shot take care of it all? Let's find out. Eric Touvenot, MD, PhD, who directed the study at the University Hospital of Nîmes in France, presented the data at this year's European Committee for Treatment and Research in Multiple Sclerosis, or ECTRIMS, annual meeting, which was held September 18th to 20th, online and in person in Copenhagen. His oral presentation was titled High-Dose Cholecalciferol, reduces multiple sclerosis disease activity after a clinically isolated syndrome, results of a 24-month placebo-controlled randomized trial, DELAY-MS. And they tell us what we already know: MS is caused by the immune system mistakenly launching an attack against the myelin sheath, a protective coating that wraps around nerve cells. While the exact causes of MS aren't fully understood, low levels of vitamin D may increase the risk of developing the disease and result in more severe disability. They go on to say that vitamin D generally fails to prevent disease activity in relapsing remitting MS. So once you've already been definitely diagnosed with having MS, it sounds like vitamin D doesn't prevent anything. But it says, however, vitamin D supplementation, even at high doses, has generally failed to prevent relapses, brain lesions, or disability progression from occurring in people with relapsing remitting MS, where relapses, periods where existing symptoms worsen or new symptoms appear, are alternated with remissions when symptoms ease or disappear. In the study, Duvigneau and other researchers conducted a clinical trial to test if high-dose cholecalciferol, a form of vitamin D that's also produced naturally by the skin when exposed to sunlight, could delay conversion from CIS to MS. For people with CIS to be diagnosed with MS, they must show evidence of damage to the myelin sheath that is disseminated in space, meaning damage that affects multiple areas of the brain and spinal cord, and in time, meaning it occurs over multiple points in time. The study involved 303 adults with a median age of 34 who had experienced an episode of CIS within the previous 90 days, or about 3 months. Most, or 70%, were women, and all had low levels of vitamin D. Well, there's some important things right there. First of all, having low levels of vitamin D is bad for a number of reasons, so that was an interesting data point. They say that a lot of us are low in vitamin D unless we're taking supplements or we get a lot of sunshine or other factors in life. A lot of us take vitamin D supplements because otherwise we wouldn't get enough vitamin D. The other thing that's interesting is that you've had to have had an episode of CIS within the previous 90 days, and I am not entirely sure how you get identified for the study, because CIS, while it may mimic certain things about MS, most doctors are going to tell you, sorry, we're just going to wait and see because we don't really know what this is yet. You don't tend to go home with a diagnosis of CIS. I could be wrong, things may have changed, but I don't know that that's true. So I guess I'm just interested to know how people ended up volunteering for this study when they didn't know that they were going to be qualified to be in the study. But be that as it may, they go on to say, importantly, these patients were originally diagnosed with CIS based on older diagnostic criteria that were in place at the start of the trial. However, with the 2017 revision of the McDonald criteria, about 89% would meet the criteria for a diagnosis of relapsing remitting MS. Okay, so in other words, their study population may have been contaminated because they weren't following the right rules. I don't know. This is interesting. The further we go with this, the more questions I guess I'm having. As part of the study, participants were randomly assigned to 100,000 international units of cholecalciferol or a placebo, taken every other week for up to 2 years. The main goal was to determine differences in the proportion of patients with evidence of disease activity, meaning a relapse, the development of new or enlarging lesions, or the presence of an active inflammatory lesion on MRI scans. Again, I'm wondering, okay, what would send me to a doctor so that I got an MRI and found out that I had a lesion? Because I would have to say, as someone who's had MS for 40 years, the lesions don't seem to correlate with symptoms necessarily. So I don't know. I think more than likely I would have thought whatever symptom I had was a one-off. I wouldn't go running to the doctor to get an MRI. Be that as it may, they said that results showed that high-dose cholecalciferol significantly reduced by 34% the proportions of patients with evidence of disease activity at 2 years compared with the placebo, 60.3% versus 74.1%. The median time to experience disease activity was also nearly twice as long for patients who took high-dose cholecalciferol, 432 versus 224 days. And again, I'm kind of wondering here, since they missed the boat on the McDonald criteria and let in some folks who ended up having relapsing MS, I would think that their data would be pretty skewed by that, because earlier on they said it doesn't seem to have any effect once you have relapsing MS. So let's see if they're going to address that. They say that vitamin D led to significant reductions in lesions after 2 years. Looking at the individual components of disease activity, the team found cholecalciferol led to significant reductions in new or enlarging lesions and inflammatory lesions after 2 years, but no differences from the placebo were observed for relapses. The supplements also didn't significantly affect measures of disability, cognition, quality of life, fatigue, anxiety, and depression. So all of those are patient reported, right? So again, I don't know why you would end up in this study in the first place, because you wouldn't go get an MRI because you had fatigue or depression, I wouldn't think. These findings were similar even after the researchers adjusted for factors such as age, sex, and the number of lesions seen on the MRI scans at the start of the study. Notably, significant reductions in new or enlarging lesions and inactive lesions were also observed in the group of patients who would receive a relapsing MS diagnosis based on the new criteria, suggesting vitamin D supplements are similarly efficient in early relapsing remitting MS, Touvenot said. This is interesting because actually what they're saying is if it's early in your relapsing MS, the vitamin D doses might actually be helpful. So it's a little bit different from what they said earlier. They go on to say that patients who benefited the most from cholecalciferol supplementation were those who had no lesions in the spinal cord, a severe deficiency of vitamin D, and a normal body mass index, which is a measure of body fat based on weight and height at the start of the study. Interesting. Okay. Again, if you only had CIS, why would you go and have an MRI of your spinal cord? I am confused. Maybe they did the MRIs once they were inducting people into the study and they ended up disqualifying the people who ended up having full-blown MS or lesions on their spinal cord. I don't know. Hard to say. And they say that high-dose cholecalciferol was safe and well tolerated, with 288 patients, 95.1%, completing the study. That's pretty good. I know people drop out of studies, life happens, but to get that many of your original inductees to go all the way through the study, that really helps validate your data. A total of 33 serious side effects were reported in 30 patients, but none was considered to be related to cholecalciferol supplementation. In line with previous studies, high-dose vitamin D supplementation was safe and well tolerated, Touvenot said. Together with the excellent safety profile, these data support high-dose vitamin D supplementation in early MS and make vitamin D the best candidate for add-on therapy evaluation in the therapeutic strategy for MS. Well, okay, that's just my take on it. Vitamin D is good for all of us. And if you're low on vitamin D, and that's something your doctor can order as a blood test to check for your vitamin D levels. If you're low on vitamin D, it never hurts to bump it up, regardless of whether this is going to help with your MS, because it's going to help with your general quality of life. And other conditions are related to vitamin D levels, and so you might want to think about that. But the other thing that's interesting to me here is, again, how in the world would these people have wound up in this study? How would they know that they qualified for it? Because you don't go in and just get an MRI for no reason at all. And so how would you know whether you have lesions or lesions on your spine or any of that? The other thing is, this kind of feels to me almost like that jump rope game that girls played on the playground when I was a kid, where you had to figure out the exact time to jump in so that you can get in there and not get whacked with the rope. So how would I know that I'm in the exact sweet spot to start taking extra dose vitamin C to keep myself from progressing to MS? That would be a trick. I think if this ever were something that doctors routinely looked into and prescribed, I think this would actually end up increasing the people who end up going through an MRI process, right? I don't know. Either that or just be doing it to kind of hedge your bets. I don't know. Am I missing something here? If I am, I hope you'll let me know in the comments and set me straight. I'm just a little puzzled. But regardless, vitamin D is a good supplement to take, and I'd highly recommend it, but I don't think 100,000 international units is really what you want to go for unless the doctor tells you differently. I take 5,000 a day, and I had my blood levels checked fairly recently, and they said that my vitamin D levels were just fine. So I think I'm just going to continue on that dosage and call it good. Well, I think this is a pretty good set to start with. I'm sure there's others out there, but we don't want this video to go on forever. If I find other things that are of interest, I'll surely be sharing them. But as I said earlier, it's nice that these particular products aren't the property of some pharmaceutical company. And I kind of proved that to myself by looking at the sponsors of the different clinical trials that we looked at today. And in going to clinical trials, I found the following. The coconut and green tea study was sponsored by a Spanish university, and I'm not going to be able to pronounce this very well, but Fundación Universidad Católica de Valencia San Vicente Martir. No pharmaceutical company in sight. The MS-14, although it sounds like it's some kind of a formulation, the study was sponsored by Shahid University in Iran, and I think from what we read in the article, the ingredients would be easily available. We would just need to know what the actual formula is. And then finally, the vitamin D study, which came out of France, Centre Hospitalier Université de Nîmes, I think that is something we can get at any drugstore and often in the grocery store as well. So what a refreshing idea. We don't even have to go to the doctor to get these. Maybe one of those would work for you. You might give them a try. It certainly doesn't cost much to do that. But that's all I have for you today. So until my next video, please do take really good care of yourself. I'll see you again soon.